अस्सलाम वालेकुम। डॉक्टर हुसैन बख्श कोलाची यूट्यूब चैनल से हम आपसे मुखातिब हैं और आज हम कोशिश करते हैं कि आपसे वर्ल्ड हेल्थ डे के सिलसिले में जो कल यानी 7 अप्रैल को मनाया जा रहा है, जब मैं ये रिकॉर्ड कर रहा हूँ तो कल इसको मैं ऑनलाइन करूँगा। इसरा यूनिवर्सिटी इज रेगुलरली ऑर्गेनाइजिंग सच टाइप ऑफ प्रोग्राम्स और हम कोशिश करते हैं कि आपको प्रेजेंटेशन की तरफ ले जाएं और उम्मीद है कि आपको ये आज की प्रेजेंटेशन अच्छी लगेगी। Since 2014, we have been celebrating the World Health Day regularly and with full commitment, and the information provided by the WHO for the health and benefit of the community and population is discussed sometime physically, but now because of the West Asia war, most of the activities are online. So from my YouTube channel, Dr. Hussain Bush Kolachi, you are requested to be connected and please like, share, and even write the comments how you feel it. And this information or this lecture will be beneficial for all the medical fraternity as well as the organization, regulators of the medical profession, so on so forth. So with this, I think you can see the World Health Day 2026, 7th April is the day when the Constitution of World Health Organization was approved or adopted, and this is a UN body on the health, and it looks and it provides technical as well as scientific research and administrative support to the member countries. And Pakistan is one of the active member of the WHO, and we are part of the EMRO region, while India is in South Asia region. So WHO have 5 regions: American, Europe, and Middle East, and then South Asia and Far East Asia. These are the regions where WHO existence is there. The theme of the World Health Day is Together for the Health, means you must unite and be in a group or in a same page for the health, stand with the science, and you should have a footing, you should have a power to rise and power to withstand the difficulties and challenges in the health through the scientific methods, not through the dogma and other myths and less researched evidence. So we have to be very fast as well as wise and to the point as a precision level so that the scientific evidence is not challengeable. Commemorating the adoption of the WHO Constitution in 1948 Geneva. So I dedicate this lecture and this presentation to the health bodies of Pakistan, Pakistan Medical Dental Council, Pakistan Medical Research Council, then Pakistan Medical Association, and even the Higher Education Commission, which is at the federal level and even at the provincial level, and the health department, which is basically the implementer as well as the field level uh, system of the healthcare delivery system. So you can see from the picture the World Health Day, the global map is there, the stethoscope is there, young, old, male, female, and health is not only centered in the doctor. Doctor is the leader of the team. Then we have a health workforce. We call it PNM, physician, nurses, and midwife, supported by the other trained and community staff. So let us move further. But before that, I think I must thank the ISRA University and the Vice Chancellor of the ISRA University, Professor Ahmad Waliullah Qazi, the Dean Basic Medical Sciences, Dean Clinical Sciences, and the Director of the ISRA Hospital, who always supported and approved this initiative, and they participate with full attention, and that program becomes one of the hallmark or flagship program of the ISRA University. And we are the university regularly inviting WHO send office, and presently it is headed by Dr. Mukhtar Bhayo. He is also from the public health, and even the country representative, we will discuss later on, even we will consider. So, Constitution was adopted in 1948, and the first World Health Day was celebrated in 1950. And these are the 78 years of global health leadership. So the leadership is basically which can face the challenges and which can take the health caravan towards its better destination where everybody is productive, healthy, happy, and smiling. So this was the background where, and now I think Pakistan is also almost 1 year, because in 1978 WHO, in 1948 WHO was constitution was adopted, but actually WHO was created in 1946, and the Second World War was ending in 1945, and UNO, United Nations Organization, was created, but health was forgotten at that time. So after 1 year, WHO was created, and then in after 2 years in 1948. So WHO is one of the successive body of the United Nations of Organization, and as end of the Second World War, and lot of research, lot of peaceful technology, medical technologies, antibiotics, vaccines, the attention was diverted. But now the West Asia war has once again created a nuclear situation, as well as public health is going in the backyard of the international discourse or discussion, and the power that be, they are not paying attention, and even the hospitals have been attacked, children in the schools have been attacked, and even vaccine production facilities have been damaged, and even the pharmaceutical factories, they have been bombarded. So this is a kind of callousness at the part of the warring countries. So we will request that the health is a gift of the God, and medical profession stands as a noble profession, and they save the life, not kill the life. So that is the difference between other fields and the medical profession. So the enjoyment of the highest attainable standard of the health is one of the fundamental right of every human being, fundamental right. You can't take away the life, and the attainable, highest attainable standard of the health is a fundamental right. Life and highest attainable. With this, let us move further. Together for health, stand with the science, and trust the evidence, invest in research, global collaboration, protect the vulnerable. And in the West Asia war, just next door to the Pakistan, in the Iran, two nuclear powers, they have ambushed this country. And I think the WHO, as well as the other organization in which the Medicine Sans Frontier, even the World Medical Association and other bodies, UNICEF, they are working, even the Red Cross is working. So ensure scientific advances benefit children, mother, and displaced population. So scientific evidence, but here the science is being used to kill these vulnerable groups of our society. Rather, together means highlights that health is a shared responsibility requiring collaboration across nations, disciplines, and communities. Nations, disciplines, and communities. When they will be together, then we can take the caravan or the goal or the scope of the health, highest attainable standard of the health. The 2026 theme calls for global unity in advancing health through the power of science. It emphasizes that science is the foundation upon which health progress is built. Health progress is built on the science foundation of the science, from vaccine to data driven disease surveillance. Surveillance means continuous monitoring. So, Dr. Tedros Adhanom Ghebreyesus, you can see that Director General is from one of the poor country and he can understand. He says that health is a human right. It cannot be taken by any warring country, not a luxury. Science is our strongest weapon. So we have nothing, not guns, but scientific evidence. And then we have Dr. Hanan Balkhi, and I think my picture is giving some kind of problem, so let I should reduce it so you can see it. That WHO EMRO Regional Director Dr. Hanan Balkhi, appointed WHO Regional Director for the Eastern Mediterranean in January 24, a Saudi infectious disease expert championing science-driven health policies across 22 countries. And what she says, science knows no border. Science knows no border. Our region's health depends on evidence and unity, but this region is now in the fire and in the warmth of the wars in which two nuclear countries, one superpower, another one of the Israel, which is a neighboring country, but it has no good relation and it can attack any country. And the Iran is being attacked and blamed for every bad thing, and they are saying that we are clean, hygienic, and we don't have anything on our hands. Everything is on the Iran hands. So I think one of the professor of the on the Al Jazeera was telling that in the last 100 years, Iran has not attacked any country. So the wise people, literate people, civilized people are being attacked, and the primary health care system of the hell Iran is one of the role model. And even in this difficult situation they are facing, they have underground facilities as well as they are training their physicians how to deal with such situation where bombs and missiles are there. So coming to the next slide that we should have. Uh, so science for polio eradication is necessary because Pakistan is grappling and we have 30 cases in 2025 and hopefully we will have a zero cases in 2026, and you can see from 74 we have reduced to 30, and Pakistan reported 59% decline in polio cases. And one of the important is the introduction of novel polio, oral polio vaccine type 2, NOPV. This can be asked from the postgraduate students and undergraduate students. This is a novel oral polio vaccine, which is NOPV2, advanced environmental surveillance through sewage testing and AI-powered tracking of the high-risk mobile population have been a game changer. So these are the developments which we want to share with you. Let us move further. Humanitarian crisis, wars, devastating impact on healthcare. The US Iran Israel conflict has caused catastrophic damage to the health infrastructures, hospitals destroyed, medical supply chain disrupted, and millions of civilians, including children and mothers, left without access to essential health services. 1,300 civilian deaths, 9,000 injuries, 77 health facilities damaged or destroyed. This is from the Iran side. 20,000 civilian building affected, where they will rest, sleep, including the hospitals and vaccine center, pharmaceutical. And now I was seeing the Wasatullah Khan Mahaz program, in which 20 universities have also been damaged, civilian building, health facilities, injuries in Iran. So this is a situation where we are locked, or so one health approach. This is now WHO is advocating. You can see from the picture, plants, animals, and human beings, and then the globe, all are connected. The plant sickness, nutritional problems can lead to the diseases, goiter, anemia, as well as other things. And if animals are sick, then you can have dog bite, snake bite, and many other zoonotic diseases, including nowadays the super flu and other pandemic and epidemic causing. The One Health approach recognizes that health of humans, animals, plants, and the planet. Humans, animals, plants, and planet, almost uh, four pillars of the health are interconnected. Science provides the tool to protect all forms of life simultaneously. So, human health through the vaccines, animal health, veterinary sciences, zoonotic disease prevention, livestock health for food security. Even in Isra University, we are running a dog bite or rabies center and also snake bite research center, which are basically zoonotic diseases. And our data shows that tertiary care hospitals, apart from other sophisticated technology, can be very successfully running rabies center, dog snake bite centers, and other vaccine preventable diseases. And even the tuberculosis is important, where latest expert gene machine and other things can diagnose. Even AI powered diagnostic tools are in the market. We can use them. Plant health, agriculture, biotechnology, crop disease resistance, and sustainable food system. Because nutrition is coming from the food and plant sources, 80 to 89%, and the animal sources. So our health and nutrition and the life is interconnected and dependent. Planet health, climate science, if the temperature rises 1.5 tipping point to pre-industrial age or era, then I think our entire system will also be collapsing. Pollution, Lahore and other cities are highly polluted. Even in Karachi, the air quality index is above 100 all the year, and it should not be more than 50. And the PM25 should not be more than 5 milligram per cubic meter, which is 12, 20, 30, and even up to the 40. So planet health is important. I was recently coming from the Lahore, though the trees were there, but the smoke from the vehicles, industries, and other urban facilities like eateries, hotels, and dhabas, every time the gas is being burned and the waste management and other things. These are even the plastic and chemicals for forever chemicals. They are part of the system. And now the Iran war has, I think, a damage up to the ozone and the air of Middle East as well as South Asia. The rise of temperature and the quality of the air, I think both are now not only with the germs and other the black rain in the Iran, which first time was mixed with the oil drops. We were normally considering sulfur dioxide and carbon dioxide, so that nitric acid, sulfuric acid, but now it is with the oil drops, so your rain is now a black rain, not acid rain. So this is a situation in which this 2026 from 28th February, this is almost 30th day of the war ongoing in almost every kind of the air arsenal or air weapon missiles, and now Sarmat missiles are also um, reported that they are interballistic missiles, intercontinental ballistic ICBM. They can damage the one end of the world to another end of the world, and even the chemicals in the ocean will damage the marine life and marine environment, which cannot be recovered in few years. And if marine water and marine life is damaged, then almost humanity will almost very close or at the brink of its end. So this is a science most powerful AI for health. You can see that how brain and the interface of the machine learning, super intelligence, and many other things are there. Even this presentation was developed by the AI. I just gave it a prompt that World Health Day is being celebrated in Israel, and we have expert from the USA. They will not only talk the science, but on the malaria, tuberculosis, and even this, and from all parts of the country. And I am thankful that the Chancellor of the Isra University and President of the Isra Islamic Foundation, Professor Hamidullah Qazi, they always supported such kind of public health activities, and even present Vice Chancellor Professor Ahmad Waliullah, they are also supporting the health initiative, whatever we are taking to the community outreach program, or even the free medical camps, or dog bite center, tuberculosis center, COVID center, and even the research on the public health and community problems is going on, including the clean water supply, and we will try to have even the environment friendly university campuses in Islamabad as well as in Karachi and Hyderabad. Lot of trees, lot of greenery, space, blue sky are visible from all these campuses. They are source of vitamin D. They are source of fresh air, as well as the ultraviolet rays are infrared, near infrared in the morning. They are actually health giving rays because they can kill the bacteria, they can kill the germs. Ultraviolet rays are a gift from the God, from the sun. And then the AI can help in epidemic forecasting, early warning system, detect anomalies in health data, triggering alerts before outbreak escalates. The drug discovery, AI accelerates drug candidate identification, reducing development from years to months. So you can now develop a drug from year to month, and even now the educational technology is giving, just like this YouTube channel or the LMS, Noodle, and other platforms are being used. AI like ChatGPT, ZAI, and Beautiful AI, and many other things, even the Gamma AI, they are commonly used. Precision medicine, personalized treatment plans powered by genomic analysis and AI diagnostics. I was just delivering a lecture on personal hygiene, that even AI chatbot can provide online information how to wash hands and how to keep personal hygiene, which can save 1 billion rupees every day at the global level, and can reduce the 80% of the communicable diseases, because most of the diseases, communicable diseases, are either sanitation and personal hygiene related or hand washing related if you don't proper. So there are 9 steps which are clearly mentioned, that how a proper hand hygiene and how you can improve the health of the people. Even 30% of the diarrhea can reduce immediately, which is one of the killer disease of the children. And you can see that the AI epidemic prediction accuracy is 97%, which was 62%. So any coming epidemic, pandemic can be diagnosed easily. And I think ISRA University and even the College of Physician Surgeon, they are looking forward to have AI training programs, AI research programs, and AI short course, so that even the Higher Education Commission and PMDC is focusing that AI should be a compulsory subject of the curriculum. I think that is a great change. So ISRA University is implementing the theme how we can implement. ISRA University student and faculty can play a vital role in championing our leadership role, the 226 World Health Day theme, through academic excellence, community engagement, and scientific research initiative. So these are the 5 areas in which social media advocacy, interdisciplinary science project, polio awareness campaign, community health camps, which now we are regularly holding. Even the oral health camps are very common and popular program of ISRA University, with the dental college of the ISRA University and community medicine department. Health research seminar, just like this information, is also based on the AI and other sources, organized in a simple and a presentable form. Organize seminars on AI in healthcare, epidemiology, and evidence based medicine. So, with this, I think Together for Health, Stand with Science is the theme. On this World Health Day, the take home message is: we commit, trust science over misinformation, unite for global health equity, act, protect every life on the earth. And I will request to the USA, Israel, Iran, and any country, even the WHO, that war is not solution. It is peace, it is health. That is important. The World Health Day to the 7th April. With this, I think I am ending my presentation. Please, once again, the students, faculty of the Isra University, and YouTube subscriber, kindly uh, uh, subscribe my channel and ask any question, we can address that. Thank you very much.